I'm Dr. Joseph Boykin, a plastic surgeon at Retreat Doctors Hospital in Richmond, Virginia. One of the most important aspects of the technology used for advanced wound healing is the application of adjunctive hyperbaric oxygen therapy. Now, hyperbaric oxygen therapy has been in place for various other types of medical conditions for probably over 50 or 60 years. It soon became fairly obvious to those medical specialists who worked in that field, even then, that there was something about the HBO environment for a patient being treated that seemed to accelerate their wound healing. We fast forward now to the 21st century, and we understand that hyperbaric oxygen therapy, when applied in a closed chamber under the most appropriate circumstances and with safety precautions, can stimulate stem cell production for the patient with poor healing, can correct the biochemical imbalances brought about by diabetes and poor circulation, can actually enhance the take of skin grafts and flaps that may have failed because of complications related to infections or poor circulation or other related conditions. So as you might imagine, having hyperbaric oxygen therapy at our wound healing center from the beginning in 1997 was a very important step toward the realization of a very comprehensive program. It's just as important for you to realize, however, that our entire program is not based on hyperbaric oxygen therapy, or HBO, as we call it. It's very important that we integrate that therapy, that very specialized treatment, in with the routine surgical and medical therapies that are required for the standard of care that still exists in medical circles today. At this facility, we have 2 monoplace hyperbaric oxygen chambers that can care for one patient over a 2-hour period during a single chamber treatment. We have been quite busy with these chambers since we got here in 1997 and have probably logged more than 20,000 dives or treatments since that time without complication. Our units have received accreditation from the Underwater Hyperbaric Medical Society, and we, I believe, are certainly first in our class for this region of the state and the country in the delivery of this treatment. We follow very standard protocols that are set forth by CMS, Medicare, Medicaid, and the private insurers, and we work very diligently to make certain that the patients are safe and cared for adequately during the time of their treatment.